Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. In the last few classes, we have explained about the Kasa. I have seen the contemporary part and the clinical approach and as well as Ayurvedic understanding and treatment of Kasa in Ayurveda. And we have also seen one clinical approach towards a child with the breathlessness. And in continuation with that class of childhood breathlessness, so we will today understand what is the concept of Shwasa, Dyspnea, breathlessness, which is mentioned in Ayurveda, and how clinically we can manage this condition, and what is the treatment protocol. So that we will go into see today. So again, welcome back. Now, treatment of Shwasa in Ayurveda. Hyperreactive airway disease and interface. That means, see, in children, if you see, hyperreactive airway disease is most common. Hyperreactive airway disease means when repeated respiratory tract infections occur, as a result, the respiratory mucosa undergo damage. The cells which are present in the respiratory mucosa, like a ciliated columnar epithelium, so they will be destroyed, and because of repeated infections, they may be modified into some other type of the cell like squamous cell epithelium. And this leads to the change in the configuration of the mucosa, and as a result, the qualitative and quantitative changes occur in mucosa. So once there is no secretions coming, then the mucosa may undergo dryness, and which may be a source of infection further. And this leads to further repeated respiratory tract infection in the child. And when this is present, usually this is present as hyperreactive airway disease. Usually we will call it as hyperreactive airway disease because of the weakness of the respiratory mucosa, dryness of the mucosa, and less protective action of the respiratory mucosa, it is more vulnerable to repeated respiratory tract infections. When such things are happening repeatedly, there may be damage and there may be a wheezing-like presentation. And that disease is called as a hyperreactive airway disease. And previously there was Kasa coming or cough coming. Later there may be wheezing and even breathlessness also starts. So this is how a Kasa, a cough, is changed into Shwasa or Dyspnea. The same has been explained in Ayurveda also in the form of Kasa Vruddhi leads to Shwasa, as explained by Vagbhata. Kasa Vruddhi Bhave Shwasa. So even in the Vegadharana Adhyaya also it is told that Kasasya Vruddhi, Kasasya Rodhat Tadruddhi Shwaso Aruchirdamayaha. So that means if the Kasa is not managed well and if the Kasa is withheld, it may lead to Shwasa and other Hridaya related disorders. So child of recurrent respiratory tract infections present with a difficulty in the breathing with wheeze like sound, indrawing of the chest wall on respiration, and even sometimes they may be using the inhalers. So all this clinical presentation can be compared with this particular interface of Kasa and Shwasa. Now recurrent infections, because of recurrent infections, there may be atrophy and as well as desquamation of the mucosa, and there is altered quality of the secretion, as I already explained, and there is change in the configuration of the cells, and that leads to hyper irritation of the mucosa. Okay, because of this hyper irritation, there may be stimulation of the mast cells, and also there may be consequent spasm of the smooth muscles leading to dyspnea. So this is how a Kasa, when occurs repeatedly, so that leads to Shwasa. So basically, due to repeated Kasa only, this is leading to bronchospasm, or once there is a bronchospasm, there will be Shwasa. So how to treat? This is quite common in children. Okay, although this is not much common in adults, this is very common in children, and maximum cases which is diagnosed as asthma, etc. So they are basically in a hyperreactive airway disorders. Details of that we have already seen in the Kasa chapter. Now, how to treat such conditions in children? First line of treatment is restore the respiratory epithelium. Because respiratory epithelium has been now damaged qualitatively, quantitatively, and there is change in the configuration of the respiratory mucosa, that has to be brought back into the normalcy. So bring back the reversal of epithelium. So now you have to give some of the rasayana drugs which is conducive for the growth of the epithelium. And you have to also use some of the soothing drugs. We will see that. Next, there is spasm of the bronchial smooth muscle which is leading to this wheezing or something like that. So therefore, Vata Hara Chikitsa should be done. This is nothing but antispasmodic treatment. Okay, Vata Sanghanga Banga Sankocha, Varta Harshana Tarpanam. So the Sankocha of the muscles, etc. These are nothing but the increased Vata Lakshanas or Prakopa Vata Lakshanas. So Vata Hara Chikitsa should be done. Now, Santarpana Chikitsa, if you give, you have to give the Santarpana Chikitsa because there is a damage and there is loss. So, this helps for the regeneration of the atrophied or destroyed mucosa. So, drugs which are rich in vitamin A and zinc and some other minerals should be given. Another line of treatment is Rasayana treatment. So, this is helpful to restore the dhatus. And as the immunity of the child also decreases in this condition, okay, so you have to go for immunological treatment to restore the ojas. Sneha Dhumapana may be helpful to maintain the antiseptic environment. Madhura and Tikta Rasa Prayoga is very good. So that helps for the healing, early healing of the respiratory mucosa. And of course, there may be cough, therefore antitussive treatment should be given. So this is simply a protocol of treatment of such conditions. Okay, so different drugs now, for example, respiratory epithelium. So we need to reversal of the epithelium means two important drugs are important. Vitamin A and zinc is very important. Vitamin A is rich in Shigurusvarasa, whereas the zinc is rich in Rasaka and some of the Anjanas, etc. So such treatment can be employed. Spasm of the bronchial smooth muscle. So we have got different drugs which are having antispasmodic treatment. Okay, sympathomimetic and parasympathomimetic drugs are available in Ayurveda like Datura, that we will discuss later, Datura, Soma, etc. So that can be used to reverse back the smooth muscle spasm. Santarpana Chikitsa, of course, Yashtimadu is one of the best drug and different other Santarpana or Rasayana Chikitsa should be given. Immunological treatment is always must because there is always problem in the immunology in the children because the T cell mediated immunity is not well developed in children. Therefore, we have to always give a support of immunological treatment. Sneha Dhumapana helps to give the soothing effect and drying effect will be get reduced. Even Yashtimadu when you give, so that also prevent the drying effect of the mucosa because it is Madhura unit rasa. Of course, Madhura and Tikta Rasa Prayoga is quite good. Madhura and Tikta Rasa Prayoga. So Tikta is also having Shita Guna and the Madhura is also having the Shita Guna and it gives a soothing effect. And if there is cough, then you have to go for antitussive treatment. Now we come to the another part. This is one commonly seen condition in children and that we have discussed how to manage. Now, management of dyspnea in children. This is the actual topic. When the disease reaches the lung parenchyma, we usually say that the disease is now reached, that is Pratishayat Kasat Rajakshma. So when there is a cough, usually the disease is pertaining to upper respiratory tract. But when the disease reaches the lung parenchyma, cough will going to reduce and rather the breathlessness will start. Okay, so Shwasa is a condition where there is increased respiratory effect, breathlessness or tachypnea, etc. So once it is there, that suggests that the problem is there in the lung parenchyma. Now, causes of Shwasa or dyspnea, respiratory distress, may be from the different three systems. According to Ayurveda, it is from the Pranamahashrotas, Udakavashrotas and Annamahashrotas. If you look into Pranamahashrotas, bronchospasm of the bronchial muscles because of the histamine release or because of the mast cell stimulation, that is a major cause. One more cause from the Pranamaha for dyspnea is a decreased diffusion of the oxygen. Because of some fluid pathologies, fibrosis, atelectasis or some other problems, hydrothorax, hydropneumothorax, there is a disturbance in the exchange of oxygen from the lung alveoli into the blood. So that may also definitely lead to dyspnea. These are the two important causes from the Pranamahashrotas. Similarly, if you look into the Udakavashrotas as cause of dyspnea, pulmonary edema-like conditions, core pulmonary-like conditions, which is suggestive of right heart failure. So they are the major causes of dyspnea, which is originated from the Udakavashrotas. Udakava, there will be improper distribution of the body fluids. So there may be edema. Okay, so there may be edema, pulmonary edema, there may be the dependent edema, or edema due to cardiac causes. Many things are there. All such fluid pathologies, they will going to lead to, if it is happening in the lung, then it leads to the disturbance of oxygen exchange. Similarly, there are some causes for the dyspnea which is starting from the annavashotas. Okay, any compression pathologies may be there, or some of the metabolic problems, because tachypnea will be there when there is a acidosis, alkalosis, they only present with the tachypnea. Okay, so the elsewhere in the body, so there is some metabolic issues, maybe in the kidney, maybe in the cell level. Okay, there is maybe in the urea cycle, Krebs cycle, etc. So all these problems will be represented as metabolic problems, and all the metabolic problems also leads to increased respiratory rate, which is called as tachypnea. So metabolic problems may be the cause. Similarly, reflux esophagitis like condition, again from the annavashotas. Okay, so they may also sometimes choking, and as well as the dyspnea may occur because of that. So therefore, as far as children is concerned, so this is how the causes may be listed, like pranavaha, udakavaha, and annavashotas. Now we have to come to a basic point that clinically what is asthma may be. In the classics about the dyspnea, many things are given. Okay, if you go for mahashwasa, urdhvashwasa, chinnashwasa, tamakashwasa, and kshudrashwasa, so first three are considered as asadhya, and detailed explanation of that has been given. But when we sit in the OPD and looking into the case of child, which case actually you have to take as shwasa, that is very important. Again, the shwasa may be a symptom, shwasa may be a pururupa, or shwasa may be a complication, shwasa may be sometimes a arishta lakshana, okay, or shwasa may be sometimes pratyatma lakshanas. So any possibilities are there. So whenever the patient comes, so you have to see whether this particular shwasa which is coming to this patient, is it a part of arishta lakshana. You start from the back side, okay, reversal order you have to start, and once you confirm that this is not a arishta lakshana, then you see whether it's a upadrava of any disease. Then you see if it is also not there, then you see whether this is a symptom of any disease, whether this is a pratyatma lakshana of any disease, whether this is a pururupa of the disease. Okay, so like that in the reverse order, you have to go on confirming in which stage actually you are attending the child. Okay, so many times it may be a complications. So then complications, if you are attending, the treatment has got its own limitations. Sometimes it may be arishta lakshana also. Like in mahashwasa, you are actually dealing with the arishta lakshanas there. Therefore it is asadhya. Okay, anyway. So clinically, when patient of what you say the dyspnea comes to you, child comes to you, so what you have to think about different causes. Number one is whether you confirm whether this particular dyspnea is there, that is whether it is because of any type of bronchospasm. Cause may be anything, whether it is because of bronchospasm. Okay, do you think then you confirm that whether it is because of any fluid pathologies. Okay, then again confirm that whether it is because of any hyperreactivity, like immunological hyperreactivity conditions. Then you confirm that whether there is inflammation, whether there is a signs of inflammation along with the respiratory distress. And again you see whether there is a decreased compliance of the lung, that is elastic recoiling of the lung, whether it is normal or not. You confirm that thing. Then again confirm whether there is a neuromuscular problem. For example, a child with a spinal muscular atrophy will also have the respiratory difficulty. The problem is atrophy of the respiratory muscles. In the later part of the recurrent muscular dystrophy also, child will have respiratory problems. The reason is respiratory muscles undergo dystrophy. So confirm whether it's because of some of the neuromuscular problems. Or again see whether there is some extra pulmonary causes are there, some compression, obstruction from the outside, or some space occupying lesions. So you confirm that. And again see whether it's because of right heart failure, core pulmonary like conditions. Of course, right heart failure is quite uncommon in children, but it may be common in adults. So whenever a patient comes to you with the presentation of dyspnea or shwasa, so first you find out the cause, whether the cause is any of these, and then you proceed. Number one. Number two, in which stage actually you are attending, whether it is a pururupa stage, whether it's a rupa stage, whether it's a the upadrava stage or a arishta lakshana stage. Okay, now thus when you get into this, broadly divided the whole cases of shwasa into two types now. Because see, what Charaka did when he explained 5 types of kasa, what I think is he has accumulated all the cases of shwasa at a time in a place, and then he actually graded it according to the severity. The most severe presentation with arishta lakshanas or complication upadravas or more, he called it as mahashwasa. And compared to mahashwasa, which is a lesser severe one, which is also asadhya, is considered as urdhvashwasa. Still quite better than the previous one, that is considered as chinnashwasa. So one which can be managed with the medicines and controlled, that is called as tamakashwasa. One which is totally non-harmful. So that is considered as Kshudra Shwasa. This is what I feel. So therefore, it is a grading which is given according to the severity of the Shwasa. Okay. So therefore, identification of that particular stage where the patient is coming, at which stage the patient is coming, that is very important. So anyway, when we plan a treatment for such conditions in Ayurveda, so we have to broadly divide this into two important categories. So that we will going to discuss in the next class. Thank you very much. We will meet again in the next class.